Are you board certified in cosmetic surgery, and what other certifications do you have?
So, certification. Again, that's something that you have to talk about definitions. There's an American board that goes over all the different medical specialties, and that's what most people mean by being board certified. There is a separate area where people say, well, I'm board certified in cosmetic surgery, and that's a gray zone, because there are certain boards that will certify you that are not recognized by the American Board of Medical Specialties. So when somebody says, I'm board certified in plastic surgery, that means they're board certified in plastic surgery as recognized by the American Board. It means they've done extra training in plastic surgery, a real residency in plastic surgery. They work in a hospital where they're in the department of plastic surgery. There's other boards like the American Board of Cosmetic Surgery where that's not necessarily the case. They train differently, they have different requirements, and the hospitals treat them differently. So you have to be careful that when you're looking for board certification, you know exactly what type of board you're looking for. I would recommend the American Board of Plastic Surgery because I think that that's the oldest and the most thoroughly trained in multiple aspects of plastic surgery. And plastic surgeons that are trained in cosmetic surgery by the American Board of Plastic Surgeons, under their auspices, they know how to do cosmetic surgery and they know how to do it safely.
What kind of treatments do you recommend post-tummy tuck / abdominoplasty?
Okay, so for procedures after tummy tuck and abdominoplasty, the main issue after a tummy tuck or an abdominoplasty is scar. People want to know what they can do to get the scar to go down faster. I think there's an older way and a newer way. The older way is to use silicone sheeting, and I think that works very well in most cases, and I recommend it strongly after the first couple of weeks once the scars have begun to heal. In addition, there's a scar around your belly button in most cases, and I think using a marble technique to help massage that area really does help a lot. There is another treatment which is called Embrace, which is sort of like silicone scar therapy on steroids. Not only does it put pressure on the scar to make the scar flatter, but it pulls the scar tighter to prevent the scar from originally stretching in the first place. You have to use it in the first couple of weeks after the surgery, after the stitches are out, and you have to use it for at least 6 to 8 weeks afterwards, but I've seen some very nice results from it. It does cost an extra couple of $100s for the scar therapy, but I think it's worth it in the long run.